I overdosed 6 times that I can remember.
People are overdosing on fentanyl in record numbers.
A matter of seconds can be the difference between life and death.
What we've been doing to prevent these deaths clearly is not working. So how do we keep people alive long enough to get them into addiction treatment?
We have to do something different.
We're taking a deep dive into a strategy that might sound counterproductive to you at first, giving people safe, supervised places to use drugs.
The solution can't consist partially of the problem.
It's a strategy other countries have been using for decades to prevent overdoses. So why has the US been slow to consider this? And why is nobody talking about this here in Florida? Let's see what's brewing. Hi, I'm Jenna Bourne, and I'm an investigative reporter at 10 Tampa Bay. If you're new here, welcome to our caffeine-fueled deep dive into issues that matter to you. Make sure you subscribe so you don't miss an episode. Tell me about why you wanted to meet at this park.
Well, this is an area where I grew up as a child, and I used to come to this park all the time when I was little, and later when I was in my active addiction, I would come here to seek refuge and use drugs. And now this park has taken on a different meaning because I have now in recovery been able to take my children here, been able to bring other women here to do step work and talk about recovery.
How many times have you overdosed on fentanyl?
I overdosed 6 times that I can remember.
How quickly does a fentanyl overdose hit you?
A fentanyl overdose is instantaneous. Before you even realize that you're overdosing, you are unconscious.
That must have been scary.
It was terrifying to wake up and discover that I had overdosed because each time that I overdosed, I was actually alone.
That's the thing with fentanyl. These overdoses can happen in seconds. I've talked to multiple people who tell me they woke up with the needle still in their arm. And as weird as it sounds, they're actually the lucky ones because they woke up. Just look at this chart from the CDC. The rate of drug overdose deaths involving synthetic opioids, mostly fentanyl, shot up 56% between 2019 and 2020. How might supervised use make a difference for people?
Someone is there to call emergency services. Someone is there with Narcan to reverse the side effects.
The facilities go by different names: safe injection sites, overdose prevention centers, safe consumption sites. Right now you're looking at video of one in Barcelona. Overdose prevention centers are facilities where people go to use drugs under the supervision of trained staff. Those staff members monitor users for signs of overdose and intervene if they start showing symptoms.
Typically, these facilities provide drug users with clean injecting equipment, safe use advice, also emergency care in the event of an overdose, and referral to appropriate social health care and treatment services.
They've been around in Europe for at least 30 years. Right now, there are more than 120 overdose prevention centers in 10 countries, according to the Drug Policy Alliance. But even within the recovery community, there are mixed feelings about this strategy.
What's not to love about jiu-jitsu?
For years, Brandon Spencer's addiction stole jiu-jitsu from him.
It turns into this phenomenon of craving, which is a craving beyond my physical control. I'll literally be walking to go get some and telling myself, I'm gonna lose everything. I'm gonna lose my wife. I'm gonna lose my kids. I'm gonna lose my job. I'm gonna be homeless. I might die. Like and I can't stop them feet from moving. I just can't stop them.
He says overdosing on fentanyl was his wake-up call to get into recovery.
For the first time in my life, I was scared to die. The pain caused by that experience equaled a consequence great enough to motivate me to do something different.
Spencer says having access to an overdose prevention center would have enabled him to keep using.
It would have hindered me. It would have gave me another justifiable reason to continue to get loaded. See, the doctors are watching me. It's okay. The solution can't consist partially of the problem.
A lot of research has been done on overdose prevention centers, but the American Medical Association kind of summed it all up in 2017 when it said, studies from other countries have shown that supervised injection facilities reduce the number of overdose deaths, reduce transmission rates of infectious disease, and increase the number of individuals initiating treatment for substance use disorders without increasing drug trafficking or crime in the areas where the facilities are located. The New England Journal of Medicine published a study on an unsanctioned overdose prevention center operating in the U.S. from 2014 to 2019, researchers found not only did no one die there, no one had to be transferred to an outside medical facility either. After decades of success in other countries, the U.S. just got our first 2 officially sanctioned overdose prevention centers on November 30th, 2021, both in New York City. You're looking at an overdose prevention center in East Harlem. The sites are funded by grants and donations, not tax dollars. Since they opened less than 6 months ago, staff have intervened in more than 260 overdoses.
I know for some they might be hearing this and thinking that this is a little bit outside the box, a little bit not what I'm used to, but we're really kind of in a desperate situation. Hundreds of people are dying every day, and they don't need to be.
Rhode Island lawmakers decided last year to authorize a 2-year pilot program to establish what they're calling harm reduction centers. The state started accepting applications in February 2022 for licenses to run those centers. Philadelphia, California, Denver, and Seattle have all explored opening overdose prevention centers, but none have actually materialized. So why is the U.S. decades behind other countries on this strategy? USF Associate Professor Dr. Carrie Rigg says Americans still have an old school perception of people who use drugs.
People who use drugs are bad, and we need to get these people out of our society, lock them up for long periods of time, and that was our approach. Addiction was a moral failing, it was a criminal justice problem, but now we have a lot more science around addiction, and we know that it is in fact a healthcare problem.
I remember being in the DARE program in the late 90s. I'm dating myself a little bit.
I'm with you, I'm right there.
But that was the sentiment that I got, was that, just don't use drugs and say no, and people who use drugs are bad and dangerous. How are we still stuck in that way of thinking in Florida?
Unfortunately, we are.
Is anyone talking about overdose prevention centers here in Florida?
No.
This is Will Atkinson. He's the executive director of the Recovery Epicenter Foundation in Pinellas and Pasco counties.
We have the 3rd largest recovery community in the United States at the moment, just here in Tampa Bay. Yeah.
He says overdose prevention centers don't fit Florida's Mickey Mouse beach paradise image.
The more that we've focused on tourism and the more we've presented ourselves as a retirement community, the less we've been interested in addressing substance use disorders, mental health disorders, homelessness, because that might be unattractive to those who would seek to live here.
We have to do something different.
That's Tim Santamore. He's the director of outreach for Florida Harm Reduction Collective, which is based in St. Pete.
For Florida, I think it's a way off. Florida's only now starting to implement harm reduction programs, implement syringe services programs. There are only 5 of them in this state.
This mobile syringe exchange is in the University Square Mall parking garage. Tell me about how many people come out here now.
In the beginning, it was, 10 or 15 was a busy day, and then 30 or 40 was a busy day, and now 75 people, usually 60 to 75 people every Monday and Friday. We have cotton, hepatitis C information. We have the syringes in multiple sizes. We have sharps containers, which are really important. We give each participant a sharps container to safely dispose of their used syringes. We do HIV and hepatitis C testing.
And of course we distribute quite a bit of Narcan, which is what prevents overdoses and reverses overdose when they happen.
Tampa Idea Exchange doesn't get any tax dollars to run these sites. They're funded by grants and donations. About 700 people have gotten services at these syringe exchanges since they opened in January 2021.
You've got to be alive to be able to get care, and we've got to keep you alive and keep you medically safe to be able to help you make it through this phase of the addiction.
Thanks for watching What's Brewing. Subscribe so you don't miss an episode, and I'll see you next time.